I'm joined by our Health Commissioner, Dr. Sarasa, and partners to kick off the Health Department lead testing campaign. Baltimore City is a proud leader in healthy homes and lead prevention. Through the dedicated work of the Baltimore City Health Department and other community organizations, we have seen an 86% decrease in the number of children with elevated blood level over the past decade. Although this is a tremendous accomplishment citywide, there is still work to be done. The Baltimore City Health Department combats childhood lead poisoning through medical case management of lead poisoned children, environmental inspection of homes with lead hazards, and enforcement of applicable laws, prosecution of non-compliant property owners, intensive primary prevention home visit, and health education, outreach and referrals of families to lead abatement programs. We all know that lead poisoning is a serious problem that can cause learning disabilities, behavior problems, and at a very high level, seizures, coma, and even death. Although we are aware of the issues of lead poisoning, it is important to note that lead poisoning is completely preventable. Here in the city of Baltimore, the Health Department has made it a priority to work towards the goal of eliminating elevated blood lead levels in children. We are doing this by working together with state, local, and national partners to prevent lead poisoning before it occurs. I'll now turn it over to our Health Commissioner, Dr. Sarasa, to talk more about the kickoff.
Thank you, Mayor Young. I'd like to start by thanking all of our partners for being here today. The Maryland State Department of Education, Green and Healthy Homes Initiative, the Maryland chapter of the American Academy of Pediatrics, and the Maryland Department of the Environment. As a pediatrician, this issue is particularly important to me, and I'm very proud of the work that the Health Department does every day to combat childhood lead poisoning. As Mayor Young said, Baltimore City is a leader in lead poisoning prevention and lead testing, with over 50% of children tested between the ages of 12 to 24 months. We believe, however, that testing for half our children is not good enough. So we're here today to renew our commitment and to implement new strategies to increase our testing numbers. Our newly launched lead testing campaign includes 4 primary components. There will be an MTA advertising campaign. This campaign will be launched in October, which is also Lead Poisoning Awareness Month, and it will target bus shelters and neighborhoods with a high prevalence of lead poisoning. The advertising will provide basic education as well as a contact number where residents can receive assistance on how to get their children tested for lead. There will also be a toolkit for providers. The Health Department has partnered with the American Academy of Pediatrics to create a toolkit that provides pediatricians with valuable information on lead poisoning as well as best practices to ensure that the testing rates are as high as they could be for our patients. The Health Department will also be providing technical assistance for practitioners who would benefit from additional support to increase their testing. We'll also be working with the Maryland State Department of Education to partner and focus on our city's child care centers. We want to ensure that children who are enrolled at our child care centers have their lead testing results on record. And lastly, we'll be doing more direct resident outreach. The Health Department is partnering with managed care organizations to identify children who have not been tested between the ages of 12 and 24 months in order to alert their parents of the dangers associated with lead poisoning and to provide additional testing resources. I want to again thank all of our partners that are represented here today. We attribute our successes to date to their hard work and diligence. I'd now like to invite up Dr. Michael Ikniowski, Chair of the Environmental Health Committee of the Maryland Academy of Pediatrics.
Thank you, Commissioner DeRosa and Mayor Young. It's a pleasure to be here representing the Maryland chapter of the American Academy of Pediatrics. Our organization is excited to be partnering with the City Health Department in its efforts to reduce lead poisoning. There is no safe blood level for lead, and the neurological damage caused by lead can last a lifetime. It is of paramount importance to identify as many children with elevated lead levels as possible, and we applaud the City Health Department's efforts to expand screening through outreach and expanding point-of-care blood lead testing. The newly developed lead toolkit will be of tremendous help to practitioners in managing their lead-exposed patients. Perhaps their most important efforts are those directed at preventing lead poisoning through home visits and community programs to educate families about the hazards of lead. The toolkit also provides educational materials for practitioners to share with their patients' families. The MDAAP looks forward to continuing to work together with the City Health Department to reduce and someday eliminate the harm caused by this toxic substance. Thank you.
Thank you. Are there any questions about the lead poisoning?
Is there any statistics available that show what the prevalence of this problem is? Say X% of people, children that have been tested, that are city residents, test positive for elevated lead levels?
Good morning, Camille Burke. The state of Maryland actually publishes a wonderful report every single year, and they actually will give it to you by jurisdiction, specifically that, how many kids have been tested, and what percentage of 1 and 2-year-olds.
Similar question, although, do we know of young people between the age of 18 and 30, because they would have been born in the peak, how many of them suffer from lead paint poisoning? That data was never.
No, unfortunately, we don't know that number.
This may be a question more for housing, but is there any idea as to how many properties are out there that are still have lead paint in them that children could be exposed by living in?
We would follow up with housing and get that information to you.
Can you say what's new this year that the city is doing different than in the past? I know you outlined a little bit, but I know there's outreach efforts every year, and what's the difference this year?
Hi, Greg Cilio. I'm the Assistant Commissioner for Chronic Disease Prevention. I'll certainly touch on that. I mean, this is a reinvigoration of a lot of the work that we're doing, but definitely the focus on testing itself really is new. Because, I mean, in the past, it's been about our home visiting programs where we go in and offer services to help identify the source of the lead and provide ongoing services. But being on the front end to figure out which kids have been affected and really doing a push to get more kids testing, get that testing number up, is something the city really hasn't focused on in the past. Our state partners, pediatricians, send us the data and say, these are the kids that came to us, we did the check, this is the numbers, but this is being proactive, reaching out to households, putting it out through MTA campaign to say, talk to parents, educate them and say, have you had your kids tested? Did you go to your pediatrician? They gave you the slip to say, go to the lab and get tested, and then you said, oh, I've got somewhere to be, I'm not gonna go. Rethink that. Go back and get your kid tested, because if they have, if they have lead poisoning, here could be the consequences. So really putting that emphasis on, understanding the importance of getting tested and identifying those kids who haven't been is an emphasis that's really not been there. And these strategies that we've laid out in this toolkit to give providers information is key.
But then what happens, okay, you take your kid to the doctor and they test positive for having lead in their system, then what?
Right, so that's when our program as the city, depending on that lead level, would step in, and we actually have home visitors that go out. We have environmental sanitarians who go out, they test the house, they find the source of the lead paint. They work with partners to, depending on the ability for that landlord or owner to remediate the issue, we work with them to get it remediated, and then we work with the children to actually figure out what we can do to get their lead level down. We make sure the child's in a safe environment. We give them the resources they need and the understanding as to how they get that lead level down as quickly as possible.
What is the course of treatment to bring the lead level down in the body? Is there a medical treatment for that?
There is a medical treatment, but it depends on what the level is. The medical treatment is called chelation. That unfortunately only kicks in with an incredibly high level. It's a natural, holistic method with diet and certainly change in environment, which is the biggest factor.
Is there a certain point where prolonged exposure creates permanent damage? I mean, how quickly does this need to be discovered for there to be cut off before there is?
Could you repeat the question again?
Is there a specific point where prolonged exposure becomes irreversible? How soon does this exposure have to be caught before
Well, the damage caused by lead in general is irreversible. The ideal situation is to identify the sources of lead before the children get exposed to them. Unfortunately, there's so much lead paint in city housing that it's a very difficult challenge to try to eliminate all of those sources of lead. As far as the treatment goes, as Camille said, chelation is used for very high levels of lead. Nutritional means of making sure that the children have adequate iron levels, that they're not anemic, that they have adequate calcium intake. These things can help to displace lead and help it to be eliminated. But there's no medical treatment in terms of medication that reduces lead at the much lower levels that we see.
So back to my question, so if we were to look at the 1995 data, for example, and at that point, X% of children in the city of Baltimore tested with elevated lead levels. assume that they're suffering from lead paint poisoning as an adult.
The consequences of that lead poisoning would very likely carry over into their adult life.
Okay, so then the next question is that it's been estimated in Flint, Michigan, that the increase in children needing special education services is up 56% due to the lead and water crisis. So do we have any idea in the city of Baltimore what percentage of our children who need special education services are there because of lead paint poisoning?
That I don't know, I defer to someone else.
We would probably have to get that information from the school system.
I don't think that that's anything that we would ever truly be able to know. You can try to make the correlation, you can try to identify the number, and even your question earlier about older adults, you can try to make that connection and say X number, X percentage of young people at that time had lead poisoning, but those numbers are probably well underrepresented. So making that connection between sort of an adult or kids in school at an older age and their lead poisoning, it's a very difficult thing to do, and those statistics just aren't there.
Okay, so I'm gonna ask this question. Is anybody uncomfortable? Why isn't that data available? Why wasn't it kept? This is an enormous public health issue in the city of Baltimore. So it's an enormous issue.
Yeah, it's just hard to create that causation.
It's increasingly linked to our violent crime problem. Does anyone know why this kind of data wasn't kept?
It's not that the data wasn't kept. I think it's just hard to create that causation, and to document that causation. So you can identify the people that were actually diagnosed at that time, that those records would still be on record. But then knowing sort of what that resulted in later in life, whether that resulted in special education is very difficult to say and isn't tracked that way. But I agree, there's definitely a lot more we can be doing with data.
Is that it? You satisfied, Jen?
It just seems to me that everybody wants to
you might-
litigation, then you better have some evidence, right?
You really might want to check with the school system. They might have those records of the children that they have within the system. I'm quite sure they can tell what child had lead poisoning and all that from their records. So you might want to check the school
I
system.
understand this, look, Helford is involved, right, got that, but, it just seems to me that this is such a.
All you're asking for is the number.
Huge public health.
So all you're asking for is the number, and I'm
Yeah,
quite
I
sure.
mean, just have some sense
I'm quite
of-
sure the school system could give us a number of how many children that they have in the system that's in special education because of lead.
18 to 34 is going to be tens of thousands of kids. I mean, we know the number's down now, like
Yeah,
hundreds per year poisoned, but
Those numbers in
mean,
the early nineties,
over 1,000, sometimes over 10,000 children
Right.
per year. Yeah.
yeah, right.
Okay, thank you. Okay, I'm excited to announce today an agreement to establish and support a Baltimore City Public Service Fellowship Program. The agreement will be critical in helping us to attract and retain the next generation of public servants into local government, who will not only help us to think through and improve programs and operations and help us better quantify and improve service delivery, but to do so with a partner focus on, as their mission puts it, enlisting talent to accelerate innovation in Baltimore and advance a citywide agenda for equity and racial justice. Many agencies already rely on the Baltimore Corps, its networks, and its ability to attract mission-focused candidates to do this work. To help them identify people to think through these policy issues at an agency level. And at the same time, we need to double down on our commitment to recruit the best to City Hall by leveraging the diversity, intelligence, and passion of students at local and regional academic institutions, as well as candidates from our neighborhoods and communities who are committed to solving the most urgent problems facing our city. I'm grateful for the thought that Baltimore Corps and Director Chi Nash at the Department of General Services have invested in this program and agreement, and for all they've done to build an entire engine for identifying the next generation of Baltimore public servants. This program will cover various classes of government fellows to meet the unique needs of departments and programs. With that, I would like to invite Fagan Harris of Baltimore Corps to say a few words about the program and the partnership.
Good morning. I want to begin by thanking Mayor Young, the Department of General Services, Jerry Bird, Cheryl Goldstein, Elise Gillespie, Babel and Lima, for their extraordinary work in getting this partnership done with Baltimore Corps. I also want to acknowledge and thank the Baltimore City Council I want to thank the entire Baltimore Core team, every single Baltimore Core fellow, my co-founder Wes Moore, my old dear friend Johnny Dorsey, who started this journey with me 10 years ago. Partnering with the city has been a foundation of Baltimore Core's work, and the city has been a key partner with the organization since its inception in 2013. We've had 62 fellows since 2013, a dozen mayoral fellows, and surely now with this agreement over the next 4 years, hundreds of more talented, immensely talented and dedicated young people will come work in public service here in our city. Public service is core to our mission. It's something that we believed in since day one at Baltimore Core. Baltimore Core fellows run towards problems and not away from problems. When you think back to the uprising of 2015, when you think back to campaigns to scale access to naloxone, the expansion of safe streets, serving the long-term unemployed, dealing with lead in our housing, facilitating trauma-informed care across our hospitals, hundreds of initiatives that may be unknown to the public but make an enormous difference to every single resident who calls the city home. Baltimore Core fellows and the staff and other leaders that we've worked with have played an integral role in that. An ethic of public service is tremendously important to the health and well-being of this city, and Baltimore Core is an engine behind that, and we're very proud of what we believe is a groundbreaking partnership between the city of Baltimore and our organization. Baltimore Core today is a hub of diverse talent and social innovation and government, nonprofit, and social enterprise in Baltimore. This contract is an opportunity to establish a national model for other cities to replicate and continue to move Baltimore forward of being, quote, the best city in the world to change the world. So with that, I'm very pleased to bring up and introduce Melanie Shimano, who is one of the Baltimore Core Fellow All-Stars through the years, who's done just extraordinary work and really demonstrates the power and efficacy of our work. So Mayor Young, thank you again very much.
Hi, everyone. I'm passionate about creating sustainable systems in which Baltimore City youth and residents can play an integral role in their city civic operations by growing into the smart city technologies of the future. And through the forward-thinking leadership and mentorship at the Department of General Services and the passion for our city in Baltimore Core, I've had the opportunity to initiate and play a significant role in programs and partnerships that will establish Baltimore City as a leader in civic engagement and city operations. Over the past 2 years, I've been able to lead projects like Code for the City to help build technology pipelines into city government with high school students, and our DGS Paperless initiative to build a more sustainable future for our city that also encourages our employees to rethink the processes and the work behind their everyday tasks. I've had the opportunity to encourage and educate our city government employees on how they can use data analysis and automation so that they can also build data-driven solutions for their own work. I've seen my fellow Baltimore cohort projects lead to impactful initiatives in the city related to local policy, education, workforce development, and racial equity. I know that this concerted effort to encourage and create a more collaborative work throughout city government will only make our city agencies in relationship with the city stronger, and I'm really excited to see how this new court of government cohort fellows enhance our city and pave the way for greater work in the future. Thanks.
Thank you. Any questions about that?
If Baltimore Core already puts people into city government, what's new about this partnership?
So what this agreement does is it integrates our relationship with the city. Right now, Baltimore Core works with each agency in a bilateral fashion. So imagine that's 15 or 20 different relationships that are all happening independently without coordination. What this agreement does, particularly with Mayor Young's leadership, integrates the agreement, helps us work with the leader of the city to make sure that we're deploying human capital to the highest need areas across the city, and also being a long-term partner for the human resource base of city government. We're a workforce solution for city government. We believe that we need great people in public service. We think Baltimore City should be the nation's capital for social change. To do that, the city will need help from organizations like Baltimore Core, who make it their mission to go out and find the best people and to recruit them into city.
And just a point of clarification, the 62 fellows number, that was for just in the city,
City
government?
agencies proper, correct, yeah.
Who funds Baltimore Core?
We're funded through a combination of philanthropic sources. We generate earned income through our activities. We pursue corporate sponsorship. yeah, we have a very diversified mix of revenue that helps keep us sustainable.
How do people get involved?
If you go to www.baltimorecore.org, our website's available. We're also active on Facebook. You can find us on Twitter. You can find us on Instagram. For the kids at home, we got a Snapchat coming online. So that was a joke. But
Well, like, what are you looking for the people who want to get involved? Like, what are you looking for out of people who want to get involved?
if you're a city resident and you care about this city and you want to invest your career, you want to invest your full-time time and talent to help move the city forward, whether it's an issue pertaining to public health, if it's an issue pertaining to community and economic development, workforce development, serving the homelessness population, you name the issue. We're issue agnostic. We work on all of these things. You should come to our website and apply for one of our programs. We place talent with the city every 90 days, every year, in perpetuity. So it really is a front door to a job and career in city government. And so if you care about moving the city forward, if you want to get off the sideline and actually help do the hard work of serving our city, come see us.
It's great you're recruiting on Snapchat, but are you recruiting on TikTok?
We're working on that. We're working on that very hard.
That's all I got.
Thank you.
Thank you. Any other questions? Thank you. Thank you all so much.
Thank you guys for following. Ms. Mayor,
Thank you.
appreciate it. Thank you.
Thank you, everyone. All right, any general questions?
Mayor Young, just the Old Town Mall is currently vacant. With the two-alarm fire that happened there last night, do you think it should just be torn down entirely?
Well, you know, because it's historic, they wasn't looking at tearing them down. They were looking at a developer that could incorporate that into the larger project. But the fire had damaged it now, and from what I'm saying, I don't see any more historical, significance to the building now. So I called Michael Braidman last night to figure out what we're going to do in terms of moving forward. And he's supposed to meet with me sometime this week to discuss that, because I would really like to see it torn down, because I think it was extensive damage. I was there last night, and I don't even know how the fire started, because the buildings are empty, vacant. So I would rather see them come down.
Who did you say you'd be meeting with about that?
Michael Braverman, I called him last night, so he can brief me on what's the next step since, the fire took place last night.
That's part of that larger overall East Baltimore redevelopment project that they're receiving the federal funds for.
That's you talk about the Perkins Old Town project.
Yeah,
That's
yeah.
part of Old Town. Then the back end is another piece. I don't think that's in the bigger scheme of the project.
Is that slate to be torn down anyway?
It wasn't. They were looking for a developer that could, fix it up and bring it back to life. We're going to ask Dan Henson and that group that's doing Perkins to see if they can incorporate the whole mall. But as you know, some of the properties in that mall are owned by other folk who have seemed not to have kept their properties up.
But the mall is not part of the development.
No,
footprint at this
no.
point.
But I would like to see all of that incorporated into one big project.
Councilman Scott today at 1 is, Council President Scott is having a hearing on the Poe Homes water outage, and which he says was terribly mishandled by the administration. Want to get your thoughts on that?
Well, I'm not going to play into that. He have every right as council president to have a hearing on anything that he want. But in my estimation, it was not mishandled.
To talk about a different project, Board of Residents approved a pilot agreement for the Marshall Gardens apartment project. Why are we in support of that, and what do you
Say that
think
again?
The Marshall Gardens project up in Upton. There was a pilot agreement approved for that project this
I'll have to get back with you on that, because and normally when there's policies that's dealing with affordability and affordable housing, to keep the affordability, we normally support those policies. But I have to get more information on that.
Mayor, as a question about money, I actually talked to the city solicitor this morning about this. There's currently a case in the Circuit Court of Baltimore pending, waiting for a judge's decision in one of the GTTF related cases, which the judge is going to decide the city's argument that we're not liable because this is so far outside the scope of their employment. How concerned are you about the financial liability that could mount as a result of these cases?
Well, you know, we have our budget challenges and with everything else, with the consent decree that we have to continue to pay, with the Carwin, you know, issue that's facing us, and our constant water main breaks where we have to do emergency repairs. I'm very concerned about that. And I'm hoping that the judge would consider all those factors that a city like Baltimore is facing, being a poor city with unfunded federal mandates that are on the city constantly. I'm concerned about that. I'm really concerned. We already have the highest property tax in the state, and you know there's no other resources that we can tap into if we get sued and they win. I mean, it's just mind-boggling. I just don't know what to say about that. I mean, it's something that has been on my mind. Not only that, but the other cases that they're talking about dismissing, which could add to that. I mean, it's just a long list of everybody coming out of the woodwork saying that, you know, this happened to them. So I don't know when it's going to stop. But I know there's a cap on what you can sue for. But I'm hoping that the judge will take into consideration some of the activities that took place with the GTTF and hold some of them liable.
The city,
If it's outside the scope of their job, why should the city be liable for something that's outside the scope of their job? I don't think the city should be liable for that.
On that topic, the city solicitor said last week that he and the police commissioner have not done an internal review yet about why Jenkins and other corrupt cops were hired in advance, because he wants to possibly outsource that to an outside firm. And do you agree with that idea?
The outside, what now?
So right now, there's been no internal investigation of GTTF, of how the hiring practices, how people advance, and that sort of thing. And Andre Davis said that it was in part because he wants to figure out a way not to incur more liability on the city in that review, and also do it in a way that's fair. And he suggested perhaps having an outside firm do such a review. What do you think about that?
Well, I won't second guess the city solicitor. If that's what he thinks that's best for the city, to keep the liability on the city as low as possible, or no liability on the city, I'm not going to second guess him. He's an attorney, I'm not.
Have you had anybody in the finance or that's talking? I mean, Los Angeles faced this 20 years ago with pretty large liability from ramparts. Have you had any conversations around the country with how best to handle kind of this kind of massive, you know?
Not really, but when I go to the mayor's conference, I think when is that? It's coming up. That's going to be one of the topics that I discuss with some of the mayors from around the country. I mean, because that's big. I mean, that is huge, and it's on my mind because I know we can't afford to raise any more taxes in the city of Baltimore, and that's not an option. So,
Mayor, you attended the BSO.
and I'm hoping, since the police department is a quasi-state agency, that the state will help incur some of the costs, if there is a cost.
Mayor, you attended the BSO contract negotiation newsroom the other day. How much more is the city prepared to help the BSO in the coming year if they're financially strapped?
I mean, you know, I haven't really thought of that. We support the BSO, and it's not just the city. They play around the state. So whatever we can do to assist them, we would do that. We are trying to push for more attendance, for people to come to those concerts. But it's important to Baltimore City, and whatever we can do to help them, I'm open to that. But it's a regional thing, so I'm hoping that the regional partners will step up as well.
Anything else, guys? Yeah, one more. A local pastor, I think it was up in North Baltimore, posted a sign on his church. I don't know if you saw this. It said, "Criminalization of black youth continues with squeegee kids." Do you have a reaction to that statement, or just why that was
I
put, you know,
can't,
up
I
front of
can't
church?
speak to that because I haven't seen it, but, I'm on record as saying that, you know, it's a safety issue and I don't want to see young people in the street, you know, doing that because they should not be doing that. But also, when they're doing it during school times, the school system have to step up, and do their part because they're children who should be in school. The only thing that I will say is if they're doing criminal activity, then there are consequences for criminal activity. But I haven't seen what the pastor posted. I mean, there's many opinions from a variety of people of what should or should not be done.
Thank you.
Thank you.
Thank you, Mayor.
Thanks, Mayor.
Thank you.